Welcome to the Smiles Are Wild channel, brought to you by Pediatric Dental Associates and Orthodontics. My name is Amy Morgan. We will be bringing you fun and educational videos weekly to help you take better care of your child's oral health care needs at home and on the go. Make sure to subscribe and turn on notifications to see all of our new videos. And remember, it doesn't really matter how you take care of your teeth as long as you take care of them from the beginning. Okay, so today we've been advertising it all week. I'm super excited. We have Dr. Garrett who's going to join us. I'm going to bring him on screen here in just a minute. But just a little bit of background, Dr. Garrett joined our practice about 5 years ago. He's been one of our main dentists here in our new location in Bentonville since April of 2016. And so we had a really interesting conversation about some of the things of why he became a dentist and why more specifically he got into pediatrics. And I just really loved what he had to say, so I wanted to share it with you guys. So we're going to go ahead and bring him on here. Dr. Garrett, you can wave and say hello.
How's it going?
All right, you're good. Okay, so if we can just start off quickly, I just want to kind of let you kind of introduce yourself as far as, tell us a little bit about your family and maybe some of your hobbies.
Sure. So I'm Garrett. My last name's Sanders. I'm from Rogers. Grew up here. Went to the University of Arkansas. I met my wife, Rachel, at the University of Arkansas, and we moved back here, like Amy said, 5 years ago. We have two little boys, Briar and Bauer. Briar's 4, Bauer's 2. We live in Bentonville. We love it here. It's been my whole life pretty much. So glad to be back. Glad to be a PDA. Glad to be doing pediatric dentistry.
All right. So, well, we're glad that you decided to come back. I do know we have a small connection in that your wife actually used to work for us back a little while ago. She was a dental assistant for Dr. Jerry, in fact. So that's a little fun little tidbit. And I'm actually a part of that story. I was vacationing with Dr. Tanya when your wife was like, by chance, are y'all looking for another dentist? And I looked at Dr. Tanya across the room and was like, I think we have the perfect person for us. So that's like super, super exciting that we were looking for someone and you were looking for a place to be. And so I think that's a really fun story. And I'm sure Rachel loves to be the one to say that she's the reason why you're here.
It was interesting because we really didn't think we were going to be able to come back to Northwest Arkansas. And that was something we kind of always wanted, especially Rachel really, really wanted to do. And I didn't think it was feasible. And then she reached out and still had Tanya's contact info, which was kind of funny. And yeah, it was meant to be. So it's good.
Yeah, that's awesome. And I know the parents here just rave about you all the time. So we're very blessed that you came back. And so we're really excited about that. So like I said in the intro, we talked a little bit a couple weeks ago about specifically why you became a dentist and then why you got into pediatrics. And your answer just blew me away. So if you can just kind of share that, just kind of tell us why you became a pediatric dentist.
Sure. Yeah. So when I was at the University of Arkansas and I was trying to decide kind of what I wanted to do, I liked medicine and I liked science, and I just kind of went around and experimented and watched a lot of different professions, pharmacy, medical, dental, and dental just seemed like a good fit for me, but it wasn't necessarily like my life's passion up to that point or anything, but I enjoyed it and I committed to that path and got into dental school and really loved it. But kind of once you get into dental school, you get to do a little bit of everything, kind of a broad experience. And I liked all of it really, but the kids and the pediatric aspect really kind of struck me just as far as like a mission. A lot of dentistry it's a technical service. So you're fixing problems. So there's an issue and you treat the issue and you provide relief or correction or maybe cosmetic improvement or whatever. But with kids, it felt a little different. Like it felt more mission driven to me. I saw all the adults in dental school that had really just terrible oral care and like a lifetime of neglect, or just maybe they just didn't know what to do. And they had a lot of issues, pain, extractions, lost teeth, whatever, loss of function, cosmetic issues. And it really struck me that for a lot of those folks, the reasoning was that they either A, were afraid of the dentist because of negative outcomes whenever they were young, and that kept them from pursuing dental care as they got older, or B, they just never were educated correctly on what to do, and over the course of a life, you build up all these little abuses and issues with your oral care, and then you end up with a bad outcome. And so I felt like in pediatrics, it was such a sweet opportunity to, if you could, through education and early intervention, if you could make a difference that you could spare people a lot of the issues that I saw in adult patients that were, heartbreaking. So I think we do a good job of that here, of really just, providing a template for people to have success and for kids to start on the right foot and hopefully have a long-term, lifetime of good oral outcomes.
Yeah, I really like that. Like I said, that was a great answer. And I think, especially when you were talking about the educational standpoint on that, on how we can start to educate kids at such an early age, as well as parents, new parents, when you're given this like manual when your kid is born, you're given, here's all the things that happens as they grow. And there's no information in there about teeth, about how they're going to come in, what's going to happen. And I think that that's something as an office that we've done a really good job with using that, taking that information and giving all of the parents the information that they need to better take care of their child's oral health care. And so I think this has just been the most perfect fit. So we're really glad that you're here. I love to pull you onto these things and make you use all your new knowledge that you got out of school recently. And so we really appreciate your time. We appreciate you, being here. So that kind of segues me into more of the educational side of what we want to talk about today. So one of the things that a lot of people know or possibly don't know is that I run our after hours emergency line. So I'm the triage assistant. So when people call in, they're asking me the questions and then I'll get in touch with the dentist and figure out what we need to do. And one of the number one calls we get is usually about teething, or it ends up being, this is happening, but then the dentist is like, oh, they're teething, or that tooth is coming in, and that's causing an issue. So there's several things that play into that. And we're not really going to be able to hit on all of those, but we're going to go over some generic information, just that as like a normal progression, what would happen during the tooth eruption phases of a kid's life. So one of the main things that I want to make sure that we're talking about is, what ages does teething normally occur? I know that can change and vary by child, but what are the normal ages where you're really going to see teething or tooth eruption? Can you kind of break that down on what ages to be looking for that?
Sure. So, kind of just to further your point, I feel like one of the most common things that we get asked in early childhood exams, so infant up through age 3, pretty universally is, why don't they have this tooth, or is it okay that they do have this tooth now, or what's the order, or is this normal? And there does seem to be a lot of anxiety among parents, especially new parents that haven't gone through it before, about what is, quote, normal. But I think generally, before we even get into the numbers, I think the one thing that parents should understand is that tooth eruption timing is broadly variable, like highly variable. And so, for instance, my youngest son is almost 3, and there's no sign of his upper second molars, but they're there. I mean, they'll come in, and that's kind of the attitude you have to have. And now, certainly, there are exceptions where there could be reasons teeth aren't there, they're not coming in, that are more concerning, but they're rare. By and large, if you just be patient, they're going to show up. But if you want numbers, that average age of like initiation of tooth eruption is about 6 months, and that usually starts with the 2 lower front incisor teeth, and then between 6 and 12 months, the average child will get the 8 front incisor teeth, and then around a year they're getting first molars. And so a lot of people too, they don't realize that the molars come in before the canine teeth, and so you'll have incisors, then you'll have a gap, and then a molar tooth coming in further back. But that's normal. That's typically always true. And the one thing that is predictable generally among kids is the sequence. So the timing is broadly variable, but the order that they come in is almost always the same. So you're going to get 2 here, then 2 here, then usually you get 2 more on top. So you do 4 and then 2, then you get first molars, and then those other bottom, those other bottom 2 incisor teeth will be coming in around that time as well. And then sometime between a year and 18 months, those canines are going to pop through. And for a lot of kids, that's kind of the pinnacle of discomfort. They're still in that age range where they can't necessarily communicate really well, and they're just an uncomfortable tooth to have cut through the skin. And then between 18 months and 2 years, they usually get the second molars. But like I said, in my experience with both of my boys, and boys in general are typically a little later. It can be 3, sometimes even after 3.
All right. Well, yes. So then So obviously, like you said, the ages can vary, but a lot of the sequence normally is the same. But that doesn't mean that they come in out of order. That that's what we're here for. That's why we recommend early dental appointments at age 1. Is just so that we're starting to track that and we can see that there's been a normal progression. Not only is it good to check in with the dentist, but also as a parent, it could just give you that kind of sign of relief that everything's okay. So just remember that, especially if you have a infant right now and they're going to turn 1. We always recommend that you make their first appointment on or around their first birthday. And again, that first appointment is super duper easy. It's usually just consists of an exam. The dentist will come over, talk to you about your concerns, and depending on the child's cooperation, number of teeth, things like that, we might possibly apply some fluoride as well. One of the next questions that I always get is, should I just put Orajel or Ambisol on that? And we know recently that they took away basically baby Orajel supposedly off the shelves because of some different reasons. But can you talk about why we don't recommend that, or for what reasons they would use it?
Sure. So, a couple of things with the what we call a topical anesthetic, or like a Orajel or Ambisol, or there's several other products. The function of that product is to provide anesthesia or numbness on a very like surface level. So it only is effective at the very, very outer layer of skin. So it's useful for things like canker sores or ulcers, cuts, things that there's superficial pain, things you don't usually see in young kids. So from a teething standpoint, the pain is a deeper pain. It's pain from the tooth pushing up through deeper tissue layers. And so even if the Orajel was recommended in young kids, it wouldn't provide effective relief for the sort of discomfort that teething causes. Beyond that, there have been studies in recent years that say that the chemicals involved in the types of topical anesthetics you buy at the store are potentially dangerous in little kids. Now, that it's vague, but it's not worth the risk. And so the gist of it is, in little ones, infants, the kids that would be actively teething, let's just not use it, because it's not going to cause much of an improvement, if any, and it's not worth the risk that you have a dangerous outcome.
For sure. And I know, then that brings me to, what type of pain reliever is best when they're teething, when they're at the age when they can start taking a pain reliever. What do you recommend for that?
Yeah, so pediatricians typically would say to be careful with Motrin under 6 months old. So if you have a really early teether, Tylenol is probably more appropriate. In general, Tylenol is kind of the first line pain reliever that I recommend to people. It's safe in the appropriate dose, and it's easy on their stomach, and it's easy to get, and it's typically effective. Kids don't have resistance to it; they haven't really ever had it before, and so it provides pretty good pain relief for them. And so if you use it appropriately, for most folks, it gets them where they need to be from a comfort standpoint. Now, the kind of the caveat or the disclaimer with Tylenol is, it's very dangerous if you give your child too much. And so, what's important for parents to remember is you need to follow the dosage based on weight. There are some great charts. If you look up any children's hospital in America, they all have Tylenol, or it'll be called acetaminophen dosing charts. And you want to follow that. You want to weigh your child. You want to know how much they weigh. You want to follow that, and you want to use a syringe with proper markings, and you want to make sure you're keeping track of the times that you give it, so that you don't give them too much. But as long as you follow the appropriate dosing and you're thorough, it's totally safe and it's very effective. Motrin is good too in the little bit older ones. Same thing though. Follow the dosage. Usually they get a smaller volume with Motrin. It's a little tiny syringe, and you just want to be careful not to give them too much. If they're having a ton of pain and you've given Tylenol and it doesn't seem to help, then you can alternate it with Motrin every 3 hours. But again, follow your dosages, keep track of your times. And for a lot of folks, something too to keep in mind is, like, if you're having a lot of nocturnal pain and the child's not sleeping well, you can kind of, if you've had a run of bad nights and you know that's the problem, give it kind of preventatively about a half hour before bed, so that it's had time to reach its effect, and it'll help them sleep. And once they get down, a lot of times you'll get a good night out of it, and that's useful too. But unfortunately, there isn't any magic. Teething rings, cold washcloths in the freezer, some things like that help, but a lot of kids aren't compliant with it. It just kind of takes perseverance and patience. But those oral pain medications are helpful.
All right, that's great. I think we have a couple more questions here. I want to kind of track back to the teething part. We use the term teething usually when we're talking about infants and toddlers and things like that. But there is a series of teeth that come in at 6 and 12 that also can cause some issues, or around that age that come in. And at that point, are we recommending Motrin, ibuprofen for that type of eruption stuff that's going on there?
Yeah, you definitely can. In my experience with the older kids, a lot of the pain issues you have with teething in the little ones is that, especially the sub one age group, is they don't understand. They don't have a concept of pain, and they can't articulate to the parent why they hurt. And so, out of frustration, they cry, or they're inconsolable. And so it's as much a communication crisis as it is like an extreme pain crisis. And so in the older kids, yeah, there is discomfort, but the kids can cope. They understand pain. They've dealt with pain to that point, and it's mild enough that typically they're fine. However, if you have a situation like with a 6-year molar, a bigger tooth, something like that, where there is discomfort, Tylenol Motrin would be perfectly appropriate in those situations as well.
All right, that's perfect. And then my favorite phone call that we get on a daily basis, I wish I knew the number of times we get asked this question,
Right.
is what should we do about a permanent tooth coming in behind the baby teeth?
Yeah, so I've seen lots of limited exams where the chief complaint was that the child had sharp teeth, and so it is very common. It is probably the number one thing we see limited exams for, and it's concerning whenever you look in there. It's clearly not normal, and a lot of times folks just don't know what to do about it. But rest assured, it's not an emergency situation. It almost never results in a bad outcome. The worst case scenario with it is that the teeth are crowded. Typically, when that occurs, when the permanent tooth erupts behind the baby tooth, it's usually because the child is crowded, and the permanent tooth has a strong drive to erupt in the mouth. And if there's no room, then the tooth will reposition itself or deflect to try to fit, basically. And so, and a lot of times on the bottom, that's where kids are most crowded, and the tooth will just sort of divert, behind as a path of least resistance. As long as the baby tooth is loose, so if you can grab it and it's decently mobile, I usually just leave them alone and try to let the child get it on their own. But there are a lot of instances where once the permanent tooth is fully broken through, that the baby tooth is not mobile. And if you can see that permanent tooth entirely and the baby tooth doesn't move, it's probably not going to thaw out on its own. And in those situations, we do frequently have to extract those teeth. But it's a simple extraction, minimal pain, and the kids usually do really well with it.
All right, perfect. I think that's great. Again, I just want to say, thank you so much for taking out your time, for giving up your lunch break for me, and coming on here and just kind of answering some of those questions. Again, we are so happy to have you here on staff. You're a wonderful pediatric dentist, and we are very blessed again to have you here right here in Northwest Arkansas with us. So I'm going to let you go and do what you need to do, and I will finish up our broadcast. Okay. All right, guys. So that's it for Dr. Garrett today. We went over a lot of information. Again, I just want to reiterate, Dr. Garrett is an amazing dentist. We have amazing dentists here on staff. Every one of them has their own reasoning on why they became a dentist, but all of them love to work with kids, and especially our kids right here in Northwest Arkansas. So if you have any questions or concerns, you can always leave those in the comments. Let me know. You can also always email me directly at amy@smilesarewild.com. We hope that we're always bringing you fun and up-to-date educational information. And again, you can find all that on our YouTube channel by searching Pediatric Dental Associates and Orthodontics. You can also follow us on Facebook and Instagram by just searching Smiles Are Wild. And that is all considered one word, just like the Instagram handle. Smiles Are Wild, and it is not like Toys R Us. We do not use the R in the middle. We literally spell out the word R, A-R-E. That's also our website, smilesarewild.com. And again, if you're on the road and you still want to get some additional information on how you can take care of your child's teeth, you can also subscribe to our podcast on iTunes and Spotify. And you can find that by also searching Smiles Are Wild. I want to thank you all again for joining us. And remember that if you want a copy of the tooth eruption chart that Dr. Garrett kind of went over, if you want to get a copy of that emailed to you, all you have to do is type the word chart here in the comments. There's also a link to sign up for that in the comments as well. And again, if you have any questions, do not ever hesitate to reach out. You can call us, email us, whatever. We're here for you. And again, just remember, it doesn't really matter how you take care of their teeth as long as you take care of them from the beginning. We'll see you guys soon. Thank you so much for watching. Make sure to subscribe and go visit us on smilesarwild.com.